hair has receded and caused me to be unhappy with my appearance. What am I to expect with hair transplants? The masculine appearance caused by the hairline has caused me to become very unhappy with myself, and I'm looking to recreate the lower feminine hairline. The estimated hairline I drew in is approximately 42 square centimeters or 36 square centimeters if you don't count the widow's peak and slight temple bits. What am I to expect in regards to transplant density and graft numbers to repair my hairline? Thank you.
Thank you for your question. You've submitted some photos and some very nicely done squares to measure the square centimeters that will be necessary to fill out the areas to lower your hairline to a more female type of hairline. And so you describe in your question that your hairline has been receding and you want an estimate to the number of hairs per square centimeter and the predictive aspects of having a transplant. So before discussing that, I think that it's very important that you first understand the cause of your hairline receding. You see, when we think about hair loss, we always think about male pattern hair loss. It is common, it is very socially understood and accepted, and people don't even think about it beyond a certain age. But we don't talk about and think about female pattern hair loss very much. It is my opinion that since there has been no blockbuster drug for female pattern hair loss like there was finasteride for male pattern hair loss, that awareness of female pattern hair loss has been less than for male. Statistically, it is estimated that 30% of women under the age of 50 and 50% of women over the age of 50 have hair loss. When a woman comes to our practice with hair loss, we don't look at doing the surgery to create their desired look first. We first look at the cause. It is very important to understand the cause. Now, if it's genetics, that's one type of situation. If you are pulling your hair back and the temples are receding, then you might be developing something called traction alopecia. And this is seen in a lot of women who wear tight ponytails or who pull their hair back very, very tightly, or do these little braids and things like that. In addition, we have to look systemically. We have to look at hormonal factors and other and nutritional factors. So prior to a transplant, a proper workup to establish the medical basis of hair loss is important. You see, when you take these drawings of those squares and you place them the way you did, certainly any experienced hair transplant surgeon can give you an estimate as to how many hairs it'll take to fill that area. But that is a slice of time, and you have to think about your future and where your hair may be progressing. This is commonly seen with men when you go to a restaurant and you see a man with quote, bad hair plugs. You wonder, why does someone have such hair plugs? Why don't they just accept their hair loss and be bald? Well, it's because that man most likely had hair in that area where you see the plugs, but the hair eventually thinned out and disappeared, leaving this, quote, pluggy appearance. Another factor to understand, now let's just moving forward with what to anticipate with a transplant. If you want the density or the coverage, don't just think about numbers of hairs. Think about also the diameter or caliper of the hair. When you look at people with thicker hair, well, it is because the hair caliper or the diameter of the hair is so much thicker, it covers a lot more. So a person with fine blonde hair needs a lot more grafts to cover an area compared to somebody with thick, dark hair. So that being understood is a part of the factor, and that's why when you look for opinions over by submitting photos, the things that we can't comment on have to do with measuring hair thickness to give you an idea. In addition, in the hair transplant field, it's kind of a free-for-all where people make all kinds of claims about the number of grafts they're able to deliver and the density of the grafts they place in a given square centimeter. Something for you to understand is probably is a little bit intuitive for a surgeon, but also is easily translatable. When you place a hair graft, you're placing literally an organ. This is a combination of the hair shaft, the follicle, the tissue around that area. So a graft needs a blood supply. And in order for that blood supply to reach the graft, there has to be literally an island, or the graft is like an island, and there has to be coverage around the area. So we call it like covering 4 sides of the graft with good circulation in order for it to take. Well, when people try to put too many grafts in an area, a certain amount of those grafts are going to disappear because they're not going to have enough nutrition. It's almost like if you were gardening. If you put the plants too close together, you're going to be sacrificing some because the available nutrition and viability will be compromised. So when you go beyond submitting a question and then looking to do consultations, you have to take that into consideration. In addition, from my experience, when it comes to female hair loss and lowering of the hairline, we try to do as much as we can with one transplant, but it is typical to need more than one transplant in order to get the maximal density to mimic what nature creates. You see, when a male has a transplant, it is acceptable to have a little bit less density, but for women, you need a lot of density, otherwise the hairs look too far apart and it creates an artificial look. In our practice, when we do transplants, we use a material called acellular matrix or extracellular matrix that helps aid in the healing of the transplants as well as in treating the thinning process. A lot of our patients, just to kind of go on a slight tangent right now, a lot of our patients who are coming are women who do have some type of female pattern hair loss, and the only currently FDA-approved drug is minoxidil. So they've been coming to us to have hair regeneration treatment. And our hair regeneration treatment has been this combination of extracellular matrix with platelet-rich plasma. Now this is relevant to you in that if we want to maximize the benefit of a transplant, we also want to maximize the longevity of the existing hair. And if there's a thinning process going on, wouldn't it be great to make that thinning process stabilize, reverse, and thicken? So you want that you want the combination so that if you are going to get a transplant, you want to get the maximal yield of the transplant in terms of survivability of the grafts, as well as stability of your hair thinning process. So to summarize, this is a simple question with a complex answer. And if you haven't had a medical workup yet, you should move forward with that and then learn about the options related to both transplant as well as hair regeneration before you move forward with having a procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.